This is a pretty hot topic, concussion, brain injury, traumatic head injury. We're going to talk about it in the sports arena because that's what my background is. And the other reason we're going to talk about it in the sports arena is because this is where a lot of the research has been done in the last decade or two. A question that I wanted to deal with from a medical standpoint is, what is a concussion? This is part of what makes the assessment of brain injury, traumatic brain injury, and concussion difficult, is because the definition is a little cloudy. It is a functional brain injury. It's not a structural brain injury. So functional brain injury, as you guys know, means the brain is not functioning normally. It's not doing its jobs that it normally does, but that's not always easy to tell. It's not a structural injury, so it's not swelling of the brain or bleeding in the brain, and you guys in your life-saving capacities have to be dealing with people with bleeding of the brain. Sometimes medical people, because of that, for this reason, kind of downplay concussions as not a big deal, but I think the research that we'll talk about in the last 10 years has told us that it is probably a bigger deal than we think. The other thing that makes it cloudy is that it goes by different terminology. So concussion versus traumatic brain injury are often used interchangeably. One study, though, in 2010 in the journal Pediatrics said that if a pediatrician used the term concussion, people took it as a lot more of a minor injury. If the pediatrician used the term traumatic brain injury, parents took it to be a lot more serious.